Hello again, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today we will be talking about ingrown toenails. What is an ingrown toenail? When a nail is ingrown, it is curved downward and grows into the skin, usually at the nail borders, the sides of the nail. This digging in of the nail irritates the skin, often creating pain, redness, swelling, and warmth in the toe. If an ingrown toenail causes a break in the skin, bacteria may enter and cause an infection in the area, which is often marked by drainage and a foul odor. However, even if your toe isn't painful, red, swollen, or warm, a nail that curves downward into the skin can progress to an infection. What causes an ingrown toenail? Ingrown toenails can develop for various reasons. In many people, the tendency to have this common disorder is inherited. In other cases, an ingrown toenail is the result of trauma, such as stubbing your toe, having an object fall on your toe, or engaging in activities that involve repeated pressure on the toes, such as kicking or running. The most common cause of ingrown toenails, however, is improper trimming. Cutting your nails too short or rounded off encourages the skin next to the nail to fold over the nail. Another cause of ingrown toenails is wearing shoes that are tight or short. Certain nail conditions are often associated with ingrown toenails as well. For example, if you've had a toenail fungal infection or if you've lost your nail through trauma, you are at greater risk of developing an ingrown toenail. Now let's look at some of the treatments for an ingrown toenail. Sometimes initial treatment for an ingrown toenail can be safely performed at home. However, home treatment is strongly discouraged if you suspect that you may have an infection or if you have a medical condition that puts your feet at high risk. For example, diabetes, nerve damage in the foot, or poor circulation. Let's look at home care. If you don't have an infection or any of the above conditions, you may soak your foot in room temperature water, adding Epsom salts if you wish, and gently massaging the sides of the nail fold to help reduce the inflammation. Avoid attempting bathroom surgery. That is, repeated cutting of the nail can cause the condition to worsen over time. If your symptoms fail to improve, then it's time to call the office. When you come into the office, I will examine your toe and select together the best treatments that are suited for you. Some of these treatments may include, first of all, oral antibiotics. If an infection is present, an oral antibiotic may be prescribed. Another treatment option would be surgery. A simple procedure often performed in the office is commonly needed to ease the pain and remove the offending nail. Surgery may involve numbing the toe with an injection and then removing the corner of the nail, a larger portion of the nail, or the entire nail. The nail may also be removed permanently. Various techniques may be used to destroy or remove the nail root. This treatment prevents the recurrence of an ingrown toenail. Together we will determine the most appropriate procedure for you. After the nail surgery, a light bandage can be applied. Most people experience very little pain after the surgery and may resume normal activities by the next day. If an oral antibiotic has been prescribed, be sure to take all of the medication, even if your symptoms have improved. Here are some tips to prevent ingrown toenails. Many cases of ingrown toenails may be prevented by these two important tips. The first tip is to trim your nails properly. Cut your nails in a fairly straight line and don't cut them too short. You should always be able to get your fingernail under the sides and ends of the nail. Second tip is to avoid poorly fitting shoes. Don't wear shoes that are short or tight in the toe box. Also avoid shoes that are loose because they too can cause pressure on the toes, especially when you walk or run briskly. Now we will talk about some myths and truths about home treatment. The first is that cutting a notch or a V in the nail will reduce the tendency of the nail to curve downward. Cutting a V does not affect the growth of the toenail. New nail growth will continue to curve downward. Second myth is repeated trimming of the nail borders is a good way to treat ingrown toenails. Repeated nail trimming fails to correct future nail growth and can make the condition worse. Another myth is that cotton placed under the nail will reduce or relieve the pain. Cotton placed under the nail can be harmful. It can easily harbor bacteria and encourage infection. Another myth is that you can buy effective ingrown toenail treatments at the drugstore. Over-the-counter topical medications may mask the pain, but they fail to address the underlying problem. If you are suffering from a painful ingrown toenail, please call our office. And as always, take care and have a great day.